So let's begin the medical journey with Dr. Lu.
Thank you. Thanks for Dr. Chio's introduction. Now we are going to start our medical journey. Are you a medical student now?
Yes.
No. Yes. Some yes, some no. Okay. There are some professor I know before, such as Dr. Xu in Danjiang University, and I think I heard that there is someone from National Yangming University. Hi, my colleague. Yeah. So there is another one from Genshin. Yeah. Teaching accounting, medical science. Okay. But now you are a medical student, huh? Right?
Yes.
Yeah, you say yes, you said yes. But you say no. As I remember, you say no. Are you a medical student now? No. So, what would you learn from this lesson? What would you expect? What is your expectation? Something different. Something different. There should be urologists. Urology, no. Medical science. Teaching experience. Yeah, good. Teaching experience in English for medical science. We use English quite often in our medical conference. Actually, we are going to have a medical conference in Taipei, and we have a guest speaker from Singapore this afternoon. After this lesson, I will go to Hyatt Hotel to go to the medical conference. We are going to talk about impotence. This afternoon. There are two words. One is impotence. The other one is impotence. that is quite different. That is, one is good word. The other is bad word. Impotence is a bad word. Everybody don't want that.
What is that?
What's that mean? That is erectile dysfunction. Erectile dysfunction. So what's different in the teaching in medical science? What's different? Yeah, you're right. Don't mix up the impotence and impotence when you are teaching your student. There will be a joke. If you make a mistake, there will be a joke. So there are many medical terms. So impotence means erectile dysfunction. Erectile dysfunction is also a medical term. So you will never, in your life experience, you will never see this word or hear this word. So that's one of the difference in the teaching in medical science. The other one is I would like to share my experience of because usually I give lectures in different countries in the world, such as Japan, Korea, in US, in Macau, in Thailand. So later I will share my experience. So let's see the next slide. Okay. So the important issue. So the first question I ask you is that what is your expectation from this lesson, from this hour? the audience expectation is very important. So the audience need and perception is very important. And audience response, some say he is medical student, but he is teaching accounting. He was teaching accounting, but he is not teaching accounting today. So suppose he's a medical student today in this hour, and the structure of the content is very important. And we need to emphasize the key points. And how to keep the audience attention? There are three important things. One is clarifying your ideas. And the other one is organizing your ideas, which is the structure of your content. The other one is visualizing ideas. You can use pictures, videos, and that is what I'm going to say. Something different in the teaching in medical science. You need to use more pictures, such as graph, statistic graph, table, and sometimes, or usually, we use videos. If you use the videos, the student will like it. Clarifying. What is clarifying? Dr. Che, could you tell something about clarifying? Dr. Che, they are similar last name. You. He's eating some cake.
Make things clear.
Make things clear. Yeah, very good. Clarify your presentation. Clarifying the goal before you begin. Let's see. There are 5 important things for clarifying. The first one is topic. What is the topic of your presentation? The topic is what you put on your slide. That is your topic. So today's topic is use the English for the teaching of medical science. The second one, audience. Audience is very important. So I frequently ask Yue, who is my audience today? Medical student, teachers, in accounting, in medical science. That make things different. So the audience is very, very important. Each time when I was invited to deliver some lectures, the first thing I will ask, who will be my audience? How many audience? How many audience? Is the class very big? Is the class small? Who will be the audience? So the audience is very, very important. And who is your target audience? And who is my target audience today? Do you think? Teachers. Okay, teachers. Not only Dr. Chen. Everyone is my target. Everyone is very important to me. And who are the people among the people attending your presentation who must listen and understand your message, accept what you are saying, and have the authority to accept or reject your ideas and recommendations. So we need to know that before our speaking. And think of specifically people who needs to accept your idea for your presentation to succeed. Okay, expectations. So May I ask you again now, what's your expectation for this lesson?
To know your experience.
Okay, good. I prepared many of my experience data. So I will show you my experience. And do you know PBL? Is there everyone heard about that? Problem-based learning. Problem-based learning. Do you have PBL in your school? National Yami University. Do you have PBL in your school? Yes, definitely. Yes. We have PBL, problem-based learning. That's a small group. There's about 10 students in the class only. And we have tutor, co-tutor in the class for everyone, for every small group. One tutor and one co-tutor. And the student need to do homework before they come to the PBL. And after the lesson, they need to do some homework. They need to search for the medical, for the journal, for the textbook. They have to prepare something and then come back again. What is a tutor doing? What are tutors doing? Just listen. Most of the time, they just listen. And the tutor do not need to be a specialist in this field. They just organize and listen. Yeah. Facilitator. It's like a facilitator. So do you have a PBL in Zhengda? So that's one of the big difference in medical science teaching.
Can I ask you a question? You mentioned that you put people in small groups.
Yes.
There is a tutor. And the tutor doesn't have to know the content?
Yes.
Then how can that person be a tutor? What will be the tutor's job?
Facilitator. Just like the facilitators. Could you say something about the PBL? Are you a tutor? Have you been a tutor before?
Yes, I have 2 years experience to be a tutor. But for us, we don't have a tutor, so we only have a tutor in our PBL group.
Yeah.
And our PBL group is about 8 to 10 persons. The other word for PBL is for personal-based learning. So it is the personal-based learning. So it's very important for
Problem-based.
medical school and health-related school. When the PBL conduct the class will divide into at least twice. And in our school we divided it to 3 times, and each time we gather for 2 to 3 hours. And the first class will be examined one case. And the student may have the case scenario. And then they read the scenario, they discuss to each other, and then the tutor guide, they have to facilitate the meeting going and facilitate the discussion. Let the student know what they have discussion and remind them, but don't tell them directly. Just have a hint to them, tell them what they have to discuss more. And before the end of the PBL class, we will remind students what they have to know. Not we. It's I think the leader of the group. He or she has to point out everything they have to read and prepare in the next class. And then this is kind of application of case and the connect to theory or the medical terminology, anything like that. And we have to do. For me, I don't know if I can do a medical student's tutor because I'm not sure. But for PBL, the content, the spirit of the PBL, they think student will do everything themselves. And the point, I think the point is the case. And the tutor guide have to write very clearly. You have to point out the case, but not in detail. We expect the student to ask questions.
Yeah, right. Thank you. I make some comment because I have been a tutor, co-tutor, and have been writing a tutor guide in urology. So every tutor and co-tutor has to go to the tutor meeting before the lesson. So they were taught about the lesson. And you know the writer of the tutor guide that would come to the tutor meeting explain the case. And that is case oriented and also problem oriented. You know, in medical science, especially in clinical medicine, we will present the symptoms of the patient first, and then that's just like you become a medical doctor in a hospital. You will see the symptom first. So the PBL is just like something like that. You have a symptom of the patient, and then you have some lab data, and then you have some image study, and then you need to make diagnosis according to the symptom and lab data. And then you have to do the differential diagnosis for this case. And you have to do the treatment plan for the treatment for this patient. And the tutor and tutor guide who are not specialists in this field, but that doesn't matter. They have a tutor meeting before the lesson, and then they have the answer, and they have the explanation about all of these things. So the tutor guide is very good, very helpful for the tutor and co-tutor.
So once you take them through the tutor orientation,
Mm-hmm.
so that they know what guidelines to follow, as an instructor, do you monitor how they tutor?
Yeah, monitor.
How do you monitor?
So the role of the tutor and tutor guide is like a facilitator, and because they know the answer. They already know the answer. And the goal for the PBL is to teach the student how to approach a patient. The process is more important, you know. So like a monitor, like a facilitator, and if the student go to the wrong way, you can bring them back. The tutor will bring them back.
But would you bring the tutors back if they go the wrong way?
Tutor got the guy.
Okay.
Because if
But then they have tutor guide. Huh?
I know they're tutor guides, but if they,
Yeah.
even if they follow the tutor guides, sometimes they go the wrong way. They don't know how to bring the
Yeah, no.
Student bring the tutor back.
Tutor will bring the co-tutor back. You know, in the tutor guide, we have several questions, suggested questions for the tutor and tutor guide. That the tutor guide will bring that back.
Is it a common practice
Uh-huh.
that medical school use PBL? Is this a common practice?
Okay. The PBL is from Canada, originally from Canada. And National Yangming University, I think, is the first university in Taiwan. We do the PBL, and we do it very well. from a clinical medical science to the basic science also. So the other one, and as I know, the foreign medical university, they also do the PBL, which are more extensive than National Yangming University.
Can I ask one more question about the tutor guide?
Yeah,
When you write the tutor guide,
yeah.
is that like 1 or 2 pages long, or including the answer, the description of the symptom,
yeah,
the
sure.
questions are very long?
There are knowledge in the tutor guide.
So like
Yeah.
a very thick book?
Not very thick. That is like just like a very
How many
about,
pages?
I think it's about 10 pages.
The
Around
reason
that, 10 pages.
The reason I'm asking this is,
Mhm.
is I'm thinking that if other disciplines would like to adopt PBL,
Yeah.
this method,
Problem
how much
estimate.
effort we need to put in to train the tutor or write a tutor guide? That's why I'm curious.
Yeah, you know, except in addition to the tutor meeting, we also have a training for the tutor and tutor guide. For the tutor and the co-tutor, we have a whole day training program. The tutor and co-tutor need to pass the whole day, need to accept receive the whole day training program. And in addition to that, we have to go to the tutor meeting before the lessons. So I never heard that some tutor or co-tutor they go to the wrong way. You know? Have you heard about some tutor or co-tutor go to the wrong way?
I don't have much experience, so I cannot.
You must have carefully selected your tutors, right?
Uh-huh.
You carefully select who to be your tutors.
Yes. We have to select.
Is he one of the students in the class or outside? I mean, and then what credit do they gain? What's benefits of tutor?
What's benefit? Yeah. You know, in National Yangming University, if you need to be promoted, like something like you from assistant professor to associate professor, you need this credit.
So they are not students.
Uh-huh.
The tutor are not students.
They are teachers.
The teachers.
They are teachers.
Even student can get tutor.
No. The student is student.
In terms of capability.
No, student is student. Student cannot be a tutor or co-tutor. The tutor and co-tutor are teachers in the university.
Oh,
And if they need this credit to be promoted.
so the like junior faculties?
Uh,
Faculties to be lecturers?
Some junior, some senior. Who is an associate professor, he want to be promoted to a professor. He need this credit also.
So tutors are part of the faculty already?
Yeah, some tutors are white hair, some tutors are black hair, and some are mixed, like me. Yeah, please. Furen University. Ah, good.
So for the PBL, actually, Dr. Rooney mentioned about for the tutors, actually, still need to have a medical or medical science background. And for the specialists about the topic, actually, there is a debate. It's particularly for the specialists who are not so good at with the topic. About
Normally teachers talk too much, so it's some kind of a debate that probably the tutor don't say too much
Yes.
for the PBL process. So that is the answer what Dr. Chen question about why tutor not in that expertise. And for our university, actually for medical staffs, we require well training for the PBL teaching. So we don't have the credit to promote any position. So that is the compulsory training.
Yeah.
So you were
For
tutors
two
before?
steps, introduction
Then from
course.
Fujian University. Have you been a tutor? I think so.
Yeah, I have been involved in the PBL teaching process for 7 to 8 years.
Okay.
So something like to be a tutor or to write a tutor guide, then that is compulsory. So I envy at the National Yangming University, you can get some credit with that.
Oh, you don't have credit from that?
No, we don't have it.
Why the teacher willing to go to become a tutor? What was the?
That is the one of the teaching tour in our faculty. So
okay.
it's required for every staff.
Okay. Okay. So some of the the teacher always like to teach, right? But when he or she become a tutor or a co-tutor, they don't talk too much. They are not allowed to talk too much. They just the role of the tutor and co-tutor just monitor or facilitator. And they have a tutor guide. They will not go to the wrong way. Yeah.
Do you think this is a good system?
I think I think it's a good system. I think it's a good system. Because medical science, they progress very rapidly, and we are not just teach them the knowledge only. We need to teach them how to learn, how to search the papers, how to search from the textbook or from the journal to get the information. So when you become a medical doctor, you need to have this ability to search, and you are faced to the patient, and you need to search for the knowledge and the result by yourself. Now, the teacher cannot teach everything, and some knowledge when we learn from university, several years later, it becomes the true knowledge becomes false knowledge. So the progress very rapidly. But I don't know in other field, in accounting, do you know the PPO is good?
We know this year, and actually, I think the problem the day before yesterday, it's actually exactly this kind of idea that we think classroom.
Use the microphone.
I think the course we had yesterday and the day before regarding to the concept of free classroom is exactly meet this idea. Yes, which means we only need to be a facilitator, a course monitor, and also the program designer, so that we can enable our students to learn by their own.
The tutor and co-tutor, they need to study the tutor guide before the lesson. Yeah, so they will know. And there are several questions in the tutor guide. They know how to do that. They will know how to do that. Okay, so that is the expectation. So what does your audience want to know about the topic of your presentation? What must your audience see to believe what you are telling them? As a result of presenting your idea, what do you from the audience to do. The other is time. What time is it now? Okay, 11:40. So I still have time to know. How much time do you have on delivering your idea? So the speaker need to know that. And make sure you have enough time for what you need to get down. That's very important. Do not try to force feed information to your audience. So when I teach in National Young University, in medical school, we have a rule that don't have a slice more than 50 in your 2 hours lessons, in your 2 hours talk. Do you have this rule? We limit our slides in 50 slides for 2 hours lessons. So don't force feed. Our teacher before force feed us. Sometimes they have more than 100 slides in 2 hours lessons. Before, I mean that before, but now we limit the slides to 50. I think it's good. Metrics, which is indicators. How will you know your presentation was successful? What are the metrics? Okay. So creating your presentation opening. The opening is very important. There are 3 ways to creating your presentation opening. You need to get your audience attention right at the start. Don't let them sleep. Is there anyone sleep now? Don't let your audience sleep. So sometimes you need to go here and go there. Sometimes around you, sometimes behind you. So make everyone awake and attention. There are 3 ways for the beginning. A question related to your audience expectation or current reality. The second one is an interesting fact related to your audience expectation or current reality. Or you can have a short story that represents your whole plot. So maybe you can use this in your teaching. And we need to structure for communicating to other groups. A context, your audience reality, your audience expectation, which become your context, and the problems preventing them from fulfilling their expectations. And you need to provide a resolution, your solution for addressing your audience problems. So you need to move their mind, move their heart, and move their body, which means action. And move their mind, their intelligence, move their heart, move their emotion, and move their body to let them become action. Visualizing is very important in the teaching in medical science, such as a video, such as graph, such as table, such as a chart, a bar chart or a pie chart for statistic. A picture is worth 1,000 words, and you don't need to you don't need to describe all the things in the picture or the table or the graph. You just simply focus on the areas that are of most interest to you or your readers or your audience. So the overall presentation structure consists of a cover slide, and your audience current reality, expectation, problems, your audience face. You need to look at your audience face. Are they sleepy? Are they angry? Are they happy? Are they satisfied? Are they puzzling? So you need to provide resolution for your audience to resolve their problems. Your solution to their problems. Okay. Logically organize details for your solution and make conclusions and then Q&A. So that's the overall. And you sometimes you can ask your audience, do you understand the words? Do you understand the meaning? Do you realize the benefit? Do you do what you are asked? So I will show you some examples for the teaching in medical science. So let's go to the folders. So any question? Yeah,
Professor,
please.
how long have you been teaching your courses in English? How long have you had experience? How many courses do you teach, like first?
You know, in National Yangming University, we don't have the whole English course. We don't have that. Do we have that? We don't have that.
We have the international program, but it's tool and department. So we have international student, but it's master student.
That's for international student. Yeah, not for the native student. Yeah, but we have. Fortunately, we have many chance to speak in English, to deliver a speech in international conference. So, that's a benefit for we can do this. Okay, this one's good. You know, robotic surgery. Robotic using a robot to do the surgery. So we need a video. If I teach this lesson and if there is no video, oh, that's boring, you know, and the student can understand what I'm talking about. So I also teach this lesson in Fulham University for the medical student, and they like it very much. You know. Let's go next. Talk something about this, the history, the progress. You need to put some pictures, and the student will know that. What is robot? The surgeon is here, the patient is here, and robot is here, and the assistant is here. And the assistant can look at this screen, and the surgeon look at this screen, and they control the surgery. They do the surgery from here and here. So one picture is worth 1,000 of words, right? The picture is very important, and you can see this.
The Da Vinci surgical system is a requisite investment for any hospital's minimally invasive surgery initiative. The Da Vinci system is the most advanced surgical platform available in today's market. The Da Vinci system consists of an ergonomically designed surgeon console and a patient-side cart with 4 interactive robotic arms, one to hold and position the high-resolution stereo endoscope, and the second, third, and fourth arms to control high-precision, fully articulated endo-wrist instruments. While seated comfortably at the Da Vinci console, the surgeon views a magnified, high-resolution 3D image of the operative site. Powered by state-of-the-art robotic and computer technology, The surgeon's hand movements are scaled, filtered, and seamlessly translated into precise movements of the endo-wrist instruments. The net result is an intuitive interface enabling unparalleled precision, dexterity, and control.
Okay. Do you like this video? Yeah, please.
Some of the many patients sue the doctor. Many patients sue the doctor because of the value of the operation. So this is good that the doctor cannot be sued because it's no fault.
Okay. The doctors still has the possibility to be sued because the robot is controlled by the doctor, you know.
In fact, not performed by the doctor.
And you know the indication is chosen by the doctor. So still the doctor need to face to the patient, not the robot face to the patient. If there is complication. So they cannot sue the robot. The doctor is responsible for that. Okay? Okay. So, this is real life. Yeah.
The procedure is begun by using the following robotic instruments: a 0-degree binocular lens, a Maryland bipolar, a prograsp, and the monopolar scissors. As you can see here, we have an intraperitoneal view. The boundaries of dissection are the pubic bone superiorly, the median umbilical ligaments laterally, and the vas deferens inferior laterally.
As a real surgery.
As we proceed with the bladder dissection, we can see that the retropubic space is quite evident. The fourth arm is holding the bladder backwards, while the Maryland dissector and the scissors are gently dissecting the peritoneal space. The peritoneum is incised sharply, with the robotic scissors in the Maryland dissector serves to provide countertension. It is essential to cut the peritoneum all the way to the base of the vasa. This provides the appropriate exposure and allows the assistants to retract freely and for the bladder to slide down at the end of the case.
Okay. What will we have for the lunch box?
No appetite.
So, beef or pork?
Chicken.
Okay. So this, you see here, the surgeon is here, the patient is here. Oh, you can see this. This is good for your appetite. What is he doing?
Fold paper.
Fold paper, yeah, you are right. Use a robot to fold the paper.
So this is for the doctors to practice?
Yeah, yeah. What is he doing? Making something. Making something. And which is very small.
A crane, right?
So that means this robot is very delicate. Can do very delicate work. What is this?
A crane.
Crane. Good.
How many cranes do you have to fold?
It depends. It depends.
At least how many?
Did you actually do this?
Yeah, you see this? Yeah, I actually do this.
How many cranes did
You
you
know,
fold?
how small is that? It's a penny. Small, as small as a penny. Okay? And you see, let's bypass this. And you see, where's the surgeon? The surgeon here, right? The patient here. The robot is here. And who is this? Anesthesiologist. Anesthesia. Doctor of anesthesia. Who make the patient sleep, right? Okay. Who is this? Who is this guy?
The doctor. The surgeon.
Who is he?
You.
Yes. Yeah, it's me. I'm doing robot, and I'm the one who need to be sued if there is complication. Not a robot, all right?
Were you in operation or were you
In operation.
the crane?
No, in operation.
In operation.
I'm in operation. This is in the operation room. Yeah. So I can see the operation field here, and which is three-dimensional. Which is three-dimensional. Okay. No, we don't see this. Oh, this is for the. You can see another technique. Okay, we can play this. Yeah, it's different, but something different. Not cutting. It's a ligation. Or still cutting.
As you can see here, I'm identifying the notch between the urethra and the dorsal vein. This is essential for placement of the dorsal venous suture. Once the dorsal venous complex has been dissected free, the fourth arm is used to provide some counter tension.
There's a suture beneath the tissue, and then you make a knot. Now you will see that. A picture is what
the ligation of the dorsal venous complex is an essential part of the
is
operation.
more than 1,000 words.
The setup of holding the needle and placement of the suture is extremely important.
You see it here?
I begin by holding the needle about 2/3 back at a slight angle. The angle is approximately 110 degrees. Once the needle is angulated, it is ready to be placed. The left arm of the robot will be used to provide some counter traction and expose the notch between the urethra and the dorsal venous complex. The needle driver is then pushed completely horizontally beyond the apex of the prostate, and then the wrist is rolled to roll the needle around the apex of the prostate and have it come out exactly equally on the other side. The suture that we're using here is a 0 capricin suture on a CT1 needle. Once the needle is pushed through, the suture is pulled up and tied. What's interesting here is you can see that a relatively unique knot is placed. This is in fact a slip knot that is placed in order to provide a secure tightening of the suture around the dorsal venous complex.
So the white one is the vein?
Yeah, that's a vein.
Surrounding the prostate?
Venous plexus. Yeah, here is the prostate. Here is the prostate.
Oh, no.
Here is the urethra, and this is the venous plexus, dorsal venous plexus. There are many veins there. You need to ligate it before you cut. So the robot is very delicate and very. The degree of freedom is very good. And this is the video system. The surgical scar is smaller than the traditional one. So the transaction. Yeah. Oh, that's for the training. You control how to control the robot. We use this for training. one. The last one. Here. You see the anastomosis. How to suture?
The urethra and bladder are reapproximated using a continuous running stitch. The two sutures are 17 centimeters in length and consist of 3/0 monocryle on an RB1 needle. Each of these sutures is tied together and 10 knots are used to bolster the anastomosis.
This is the bladder.
The posterior anastomosis is then performed beginning at the
suture
5
the
o'clock
bladder to
position
the urethra
and running posteriorly
make
to the 9 o'clock position.
Anastomosis.
We begin with an outside-in stitch on the bladder side, followed by an inside-out in the urethra.
Yeah, there's a polycaster from the urethra, and you can identify the position of the urethra. You make a suture there. So the ligation is also a medical term, right? Ligation. Dissection.
The sutures pass 3 times through the bladder and twice
Anastomosis.
through the urethra.
So there are many
Once
medical
this is
terms
done,
for
we
the
are ready
teaching in the
to
medical
bring the
science.
bladder down to the urethra.
Okay, let's see. And this is for clinical medicine. And we have also examples for the basic science research in the teaching of medical science. This is also clinical. And some medical for stem cells. Stem cells. No. Again, this one. Okay. This is for the needs put some pictures there, right? And to introduce the multiple roles of biomaterials in stem cell tissue engineering, right? Okay. You can make some graph pictures, right? Okay. This is for the cell culture, isolation, coronal isolation, many medical terms. Gross appearance of your result. And staining, histology. Immunohistochemical study. And this is the organ bus study. Electrophysiology study. The result, and this is immunohistochemistry study. And this is the in the lab, experiment in the lab. And this is bar graph, statistically, right? Bar graph, right? It's very important in medical science, in especially basic research, also in clinical research. I will show some of your award, right? And the student will believe you. Okay. Here's some flow chart. Okay, some result in histology. Flow cytometry. Right. Line graph. Immunohistochemical study. Flow cytometry. Okay, there's molecular biology, result of the molecular biology, and the bar graph, the statistical. Western blot and the statistical result. Staining, molecular biology. I will show you papers. Show you SCI papers, and let the student believe you. Right? Let them believe you what you talk is real. Okay. Show your papers to them and make a conclusions, a short conclusions, usually one slide. And for the students' lesson. Do I still have time? Any question? Yeah, many questions. Thank you.
For your terminology or acronym like BPH,
okay.
do you put some Chinese on the slide, or you have another supplemental material to help them understand the terminology?
Okay. Usually I don't put Chinese in my slides. I would see who will be my audience. If the audience is the population in the society, who is not a medical background, who is not medical background, I will use the Chinese. But for the medical student, I don't put Chinese. And for the medical doctor, I don't put Chinese, even in Taiwan.
But maybe some medical students are not that smart enough.
No, they have to learn about that. If I'm teaching urology, they have to know what is BPH, what is benign prostatic hyperplasia. So they have to know that. So there is one example when I teach in the National Yangming University for there's Yangming. Yangming teaching. For the medical student, there's a 2 hours lesson, and I put 50 slides, not 51. You cannot put 51. In National Yangming University. I teach them female urology and learning core. Okay, I put some pictures there. The light, please. Light, decrease the light. UA. Yeah. Okay. I tell them what is incontinence, what's the mechanism, what's the mechanism of the incontinence, what's the anatomy here, anatomy, and the mechanisms, and the definition, right? The definition, the causes of incontinence, and this the urodynamic study setting. How to treat the incontinence. Injecting therapy, stem cell therapy. This is radiology, and this is the pathology, and this is the surgery. How to do the surgery. How to do the surgery. So many pictures in my teaching slide, right? And the flow chart. This is interstitial cystitis, the big the appearance of the interstitial cystitis in the bladder. Right? About overactive bladder. What is overactive bladder? How to diagnose, how to treat, and what is the side effect, how to do the surgery. This is the guideline in Taiwan, which is made by me, and conclusions. So I teach 50 slides, not 51. So any questions?
Yeah, continue with the previous question. If you don't put Chinese on, then your student probably don't know how to explain it in Chinese. But when they are become doctors, they cannot communicate with the patient.
Oh, that's a good question. But I don't have this problem. I know BPH is 射物腺肥大. I know the prostate is 射物腺. I know bladder is 膀胱. Incontinence I know is 失禁. So
Will your student understand that in the future they can communicate effectively?
you know, because our textbook is in English. Our textbook is in English. So you know, one of my patients came to see me several days ago, who is come back from US, and he wondered, wow, how do you use English for your medical records all the time, or just for me? You know, because I came from US, and you use the medical records. Do you use the medical record in English all the time, or just for me? I say I use the English in my medical record all the time, not just for you. He said, why? I said, because our textbook is in English. I learned the medical science in English. So, and we also need to be international. So that's good. You know, in mainland China, they are in Chinese. So they will have the problem when they go to international. They have to learn English and then go to international. So they are better now. They are better now. Much better now. If they learn English more frequently and they go abroad to attend the conference more frequently, they are better now. Some or most of them are better now. And I think some of them are better now.
To my knowledge, some of the major hospitals in Taiwan, they use English. The doctor, whenever they diagnose a SIU, they use English. Right?
Yeah.
At Taiwan National Taiwan University Hospital, 用 英文的.
Yeah, everyone. Everyone.
下诊断书的时候，诊断书是英文的。
Yeah, everyone. But诊断书我们写中文. We write in Chinese.
Oh, no, the doctor always write in English.
Let me see.
Medical
records is in English. All of the medical records, including outpatient, inpatient.
He's explaining
certificate in Chinese. Certificate in Chinese. The 诊断书 is certificate. Certificate in Chinese. But you know the medical records. When you are going to the hospital, you say I want to copy the medical records, which is in English. In every hospital we do that.
And when you teach in the classroom, all the students is Taiwanese.
Yeah.
Okay. Do you teach in English?
Slides in English. Speaking in Chinese.
In Chinese.
Yeah.
Okay.
But you know the medical term we still use in English.
Okay.
Such as BPH, incontinence. We don't say Chinese. We speak in English.
Okay. That's why. Okay. There's no problem.
Yeah.
You
So that's
English.
yeah.
And then the speech is in Chinese.
Yes.
So the student can understand the English or Chinese.
Yeah. Even for the medical student, that's fourth grade medical student. I still, that's all of my slides in English. Right?
Do you teach in English?
No, I teach in Chinese, but half of the time is in English. Half of the time.
Another question.
Uh-huh.
You know, urology, and there's a lot of picture, video that is,
Yeah.
will make your audience, the students feel so embarrassed. How do you deal with it in class? Vagina and a lot of things that you have to explain them. And they all see man and woman, they see them.
Oh, okay. You know, they will, you know, for the medical student, in my class, more than 100 students. More than half of them are girls. They will not feel embarrassment because they have studied in anatomy, they have studied in neuroanatomy. So that's science. That is science. So they will not feel embarrassment. Yeah, we don't have this problem. Yeah.
Just now, Professor Che mentioned that we are getting age. So sooner or later
You'll come to see me, right?
suggestion for all can prolong the time seeing you here.
You can come to see me during lunch. I will stay for lunch. Suggestion for prostate?
No, for more.
What? Urology. The erectile dysfunction or? Let's talk in private. Do you agree we talk in private?
Yeah.
Okay, good.
Excuse me, I just know that in Japan recently there's issue in terms of plagiarism. And my question is that do you think the so-called
everyone can hear you.
I don't know how to say that. It's 万能细胞.
Oh,
Japan.
Very important.
Very
important stem cell.
Do you think it is existent?
Yeah. I'm doing that. That's my stem cell research is my research. My National Science Council. I have a project in National Science Council, which is a stem cell research.
So it has a better function than the cell.
Sure.
The stem cell.
They have the ability of multipotent differentiation, and they also can proliferation. Can do the proliferation of the cells. And the final goal is to repair the damaged tissue and the organ.
My second question is that about crown.
Crown.
So it's a controversial issue that when it comes to ethics. It causes some kind of just conflict with the human ethics. So how do you think about that?
I think that's possible. Crown is possible in the near future.
You support it.
Oh, that's an ethic issue. We have ethic consideration about that. So everything about this we need to follow the regulation.
I have a question about the Da Vinci system.
Okay.
Has it been applied to remote surgery in Taiwan?
Yeah. No, not now. Yeah, just in the operation room now. The operator is here and the patient is here, but they are in the same room in Taiwan. They are in the same operation room in Taiwan. But initially, that was designed in US for remote surgery. Why they design this? Why do they design this? Because the American government, they send the soldiers to to Afghanistan, and the soldier will be injured, and there are not many doctors in Afghanistan, not many surgeons in Afghanistan. So the surgeon will be in the U.S., the mainland of the U.S., and they will control the master, and that is called the so-called master, and the slave is the robot. Robot will be in Afghanistan. They have, that's possible, and they have this experience. The surgeon is in France, and the patient is in U.S. They finish an operation like this, and remote operation.
Yeah, I think it should be used in this manner. For example, for the outlying islands in Taiwan, if somebody needs a surgery, for example in Anwu, that the doctor in Taipei can perform the surgery for him or her. I think that would be a very good thing.
That the original design is for that, but even in US they don't do that now. The master and slave is robot still in the same room. I think it's economic consideration. You need to have many cases, otherwise you cannot afford the expense of the machine.
So the system is still very expensive?
Very expensive. You know, the full set of the machine need to be accounting, right? Need to be the expense is about let me see.
1 million?
Yeah, approaching 1 million.
US?
1 million? Let me see. No, not 1 million. It's about 10 million. 10 million.
$80.
No. 100 million. 100 million. New Taiwan dollars. 0.9 million. Yeah, 0.900 million. 0.9 100 million new Taiwan dollars. Yeah. Very expensive.
It's about 3 million US dollars.
Yeah. Divided by 30. Yeah. Accounting, don't say nothing here. I divided by 30, is it correct?
Life is priceless.
Huh?
Life.
Deserve, right? Yeah, they deserve.
We can take one more question before the end of the session.
Okay. Oh, so then you're first.
So, the question about the WC system. Yeah. I'm wondering how reliable is the system, WC system, and if during how reliable is WC system? If what would you do if the WC system fail or not during the surgery? What would you do? Yeah,
Okay.
and also, the following question is that would this type of machine or system replace the manual surgery?
Yeah.
Completely.
Yeah, that's a good question. Accountants, they sue the doctor. Yeah, but I have done many cases, but I failed. One time I experienced the machine is out of order, but it's temporary, just about 1 hour. They fix that, but but it's still not a very big question because we can convert the surgery using the laparoscopic surgery without a robot. We still can complete the surgery. There's no problem.
Okay, because of the time, I think we'll call it the end of this session. We see some similarities between PBL and the flipped classroom. We somehow push students to think and learn on their own and push the learning responsibility back to our students. We see some similarities here. We also learn a little bit of medical knowledge and the most updated surgical procedure. Happy to know that I'm not a medical student. I can only need to endure this 1 hour and then say, okay, I don't have to learn anything. Hope that videos did not actually ruin your appetite for lunch. Let's thank Dr. Liu for this session.